Good morning. My name is Debbie Pyatt. I'm a fitness and wellness specialist too with Memorial Health System. This is part of my 12-minute home workout series. And I promised you today that I would do hip mobility and flexibility. Now, why is that so important? As we mature through life, we start to take smaller stride lengths in our walking. We don't pick our feet up as high. That causes us to fall. Major injuries happen when that occurs. So by keeping the hips flexible and nice and increasing the range of motion and the mobility that we have, we can keep our stride length normal, keep elevating our feet to the right height, and what's going to happen is we don't have to create a new center of balance. You spent years with a certain stride length, a certain way that you lift your feet, and all of a sudden, because of fear of falling or tight hips, we shorten that stride length and we keep our feet close to the ground. That actually puts you at a higher risk of falling. So hip mobility, flexibility is going to help to give you quality of life. The hips are the center of the body. Therefore, if we keep them flexible, everything above the hips is going to help realign and stay healthy for you. Everything below the hips is also going to realign and stay healthy for you. Many times it's not a back issue or a knee issue. It's because the hips are too tight that causes the issue in the knees or in the back. So let's get started. We're going to keep this to 12 minutes. And really, 12 minutes, if you do this 3 times a week, is really going to change your life. All right, I'm going to start with a standing exercise. And I'm going to turn this chair around and hang on to the back of it. And we're just going to do some dynamic movement in the hips. So, legs going to go out, cross the midline of the body. Out, cross the midline of the body. Now I'm loosening up the outer thigh, using the inner thigh. I can feel this a little in my back because my back's a little tight right now. But this is dynamic movement. And it's going to mimic some of the movements we do with the exercise, but it's just getting circulation flowing in this area, which is crucial to staying flexible. All right, now I'm going to pick it up, go to the other side, same thing. Out, cross the midline of the body. Now I'm staying lifted through my rib cage. My abs are tight and engaged. My chest is open, which means I'm not standing here with rounded shoulders. Good posture all the time. Stay lifted. I'm not flinging that leg out. I'm controlling the extension to the side and crossing the midline of the body. It's getting these loosened up already. It's getting them warmed up, ready for what we're going to do to stretch. You never want to stretch cold muscles, so we're doing dynamic movement in order to get things prepared for what we're about to do. All right, so that got us moving a little there. Now, I'm going to put one foot up on this chair. Now, you don't have to go this high. You could actually do it from a step, maybe 6 inches, rather than putting the leg up this high. Abs are tight, rib cage still lifted. Make sure you're stepping out far enough with that support leg that the knee is not pushing beyond toes. My knees are angling open toward my second toe. They are not coming forward. That will injure your knees. But I feel some resistance through the hips as I push them open and as I press down a little bit lower. Now both sides feel this completely differently because I've got a support side with my foot on the floor and then I have an elevated side. So I'm feeling a little bit more in the elevated side. Again, this is dynamic movement in order to stretch those muscles to start to loosen the hips. It gets circulation flowing. I'm driving into the heels of the feet and not the balls of the feet. Constantly pushing outward, so I'm feeling pressure on those outer thighs. Giving it a little squeeze every time I come up. All right, we're going to change sides. Now you shouldn't have to move a chair back and forth. I'm doing that so I don't turn my back towards you. Again, driving into the heels. Feet are rooted and grounded, whether on the elevated surface or whether on the floor. I have toes engaging too. God gave us 10 toes for a reason, and they really help with balance. So squeeze those toes into the floor. Now, I said this is a warm-up to get the hips warm, but this is increasing your flexibility. This is increasing your mobility and your range of motion. So you could literally just do the first 2 exercises and start to see change in the mobility of your hips. Reduced pain, reduced inflammation. All right, now, going to go down to the floor. If for some reason you can't get to the floor, you could actually do this on an elevated surface such as your bed. Feet are going to be in what is called a butterfly position. So soles of feet together, knees open wide. I'm going to extend my arms back and lean back. Let your knees drop open to the natural flexibility you have. Now what I'm going to do is I'm going to lift my body and push forward. Much deeper stretch through those hips. Little pause here, pick it up, take it back. Pick it up, take it forward. Your goal here is to get the pelvis all the way up to the heels. Now, if you have some sort of shoulder issue or your flexibility has gotten pretty tight at this point, you might not be able to lift the body. You can put a hand towel underneath you and you can actually just slide forward. Hold it there for a few moments. Again, this is a form of dynamic stretching. That means we are moving to get good range of motion. Then I pause for a moment, let my legs adjust, my hips adjust. Pick it up, get as close as you can to those heels. Let those knees drop open then. When you're doing that lift, your knees want to come up a little bit. Make sure as you go forward, you don't keep them in that upright position, but let them drop open. All right, now, I'm going to face you, and sometimes this is called a 90-90. So we're gonna put our legs like this. Now, you can see my right hip is elevated. That's all right. My back is a little bit tight, my hips are a little bit tight. What I'm going to do now is I'm going to put my hands out around this knee, and I'm going to lay my chest down as close as I can get, but keeping those legs in the same position as when I started. Again, some dynamic movement, lowering into this, and then coming up. Lowering into this, little pause at your furthest extent, and then coming back up. Lower, and come up. Now the position my legs are in when I start is where I keep them. As I go forward, I push down through that back right hip so my buns don't raise up off the floor. As I'm doing this, I'm getting lower and lower each time as my flexibility increases. One more time. And change legs. Whatever position your legs are in is where you keep them. So what I'm saying is, I don't pick this knee up in order to get down farther. I keep it on the floor. We lower and then lift. Notice I'm doing this in slow movement. I'm not going quickly and I'm not bouncing. We never want to bounce. This is dynamic stretching, so there is movement involved. Now, can you take it and do a static hold? Absolutely, but most people's hips are so inflexible at this point in their life. This dynamic movement gets you more prepared to do a static hold. What do I mean by static hold? I go down and I stay here and I hold and I breathe. Now, if you're gonna do this, make sure you lengthen the spine. Don't round the back. That's not gonna stretch the hips. Lower it down push it up. Always thinking, lengthening the spine and the neck. I'm not dropping my head down to try to get lower. And up. And this one is really going to help us with the next one we're going to do to increase that range of motion to get things loosened up before we do it. All right, now we're going to come up and feet are going to be apart. I'll lean back on my hands a little bit and I'm going to drop my knees over to the right. Now I'm doing an internal and an external rotation through the hips. I bring them back up and then I drop them to the left. Now our goal here is to keep the buns on the ground and to get those knees all the way down to the ground. Now I put that other stretch that we did just prior to this before this one, so that way we're prepared to do this one. It's very difficult for a lot of people to get that back knee down. So we are warmed up now to give us the capability to be able to do that. If you can't get there, that's fine. That's why you do this. But it's showing you that your range of motion has been limited. It's about quality of life. I talk about that all the time. With the Matter of Balance classes that I teach, one of the things I try to let people know is limiting that hip mobility is one of the main reasons that we stumble and fall. Our body goes for years with a certain center of balance, and then our hips get tight, and then we get a little fear in us of falling, and we shorten that stride length. Therefore, our body no longer has the muscle memory to keep us balanced and upright. So by doing these gentle exercises, we're going to start to increase the flexibility in the hips again. That's going to reduce your risk of falling. Plus, you're just going to feel better. Like I said, hips are the center of the body. And if the hips are tight, it's definitely going to affect your back. It's definitely going to affect your knee alignment. So it might not be a knee issue. It might not be a back issue, but hip issue. So let's pay attention to the hips, get them loosened up, and realize just by doing this for 12 minutes, we're improving our quality of life. I think we're all worth that. Like I said, if you can't get down to the floor, that's perfectly fine. You can do this on your bed. Now, it's going to be a little bit easier to do it on your bed. Your range of motion isn't going to be as great, but that's where you start out. Then you can go to the floor. All right. Now, sitting up, slide those hands back a little bit. I want you to cross your left ankle over your right knee. It's kind of like a number 4. Now, if you can't get your leg up there, which many people can't, you can actually go down to the floor and lie all the way down to cross it over. It's a lot easier in this position. If you have the flexibility to do this in an up position, you're going to get a little bit greater stretch. Over time, if you have to lie down, that's fine. But over time, going to this position where we're sitting up. Let's change legs. So it's the ankle that I'm putting across the knee, and I'm pushing with my own muscular resistance that right knee open. It wants to be up here because it's comfortable. We don't want to be comfortable. Push that knee open, stretching those hips. We've done a lot to warm them up, a lot to increase our range of motion. So now let's take it to the next level. This is a static stretch. We are holding it here. All right, legs straight out in front of you now. And we're gonna cross the left foot over the right knee. I'm gonna take my right arm and pull that knee towards my right armpit. Left hand is gonna go on the floor as close to my bottom as I can get it, and I turn and look over that left shoulder, constantly pulling that right knee, or left knee, towards the right shoulder. Feeling that stretch through that outer thigh right into that hip and gluteus medius. Hand is close to the body, because this way's a lot easier. We wouldn't want it easy. Remember, a good stretch, you want to hold for a minimum of 20 seconds. We've switched to the other side now. Sometimes it feels good just getting into that position and counting 1, 2, 3, 4, 5, but that is not getting a signal from the brain to the muscle to elongate the muscle, to relax the muscle, to increase range of motion. Pull that right knee towards that left shoulder. Right hand is as close as you can get it to your bottom, to your back side. All right. I hope you've learned something today. I hope that you've enjoyed these stretches. At the most minimal level at all, you're going to feel better if you start to implement these. Even doing them 1 time a week, you're going to feel better. 3 times a week, over 3 weeks' time, you are going to see a huge difference in your flexibility, your range of motion through the hips. It's going to cause you to be more stable on your feet. It's going to reduce back pain and knee pain. It's going to be a quality of life decision for you to make, and it's only 12 minutes. Thank you very much. Again, my name is Debbie Pyatt. I'm a fitness and wellness specialist too with Memorial Health System. This is our MOVE series. They bring me to you to help to get you to exercise even at home and improve your quality of life. I'll be back next Friday. Thank you. Bye-bye.